Now let's talk a little bit about what have we learned. In the past few years, since the advent of this digital revolution, what do we know about implementing programs that we can use to strengthen how we move forward? Recently, we were commissioned by the Bill and Melinda Gates Foundation to do a review of frontline health worker-focused programs in a number of countries, looking at what might be the factors that allow a program to go to scale. Now, in this process, what we found was in countries like India, a fair number of projects have reached fairly large levels of deployment across a number of verticals, from maternal health to mental health, nutrition, family planning, and reproductive health, and so forth. We've seen that smartphones are really dominating the market in terms of the types of devices being used in these large-scale programs. Tablets are also increasingly used as a lower number of programs at that level of scale are still using feature or non-smartphones. The levels of scale vary anywhere between 50 users to more than 1,000 users, with a fairly equal distribution of size of project across that spectrum. Another country we focused on was Kenya. Similarly, a wide range, largely in Kenya working on infectious diseases with an equal focus on maternal and child health. Similarly, we've seen smartphones dominating the use in program setting, and although not as large-size programs as we've seen in India, but still a fairly large-scale implementation of these programs between 50 to 500 users. Now, one of the things we also noticed was a large number of projects existed at the sub-500 user scale. When we looked at that next tier, between 500 to 1,000 users, there was merely 4 projects that we had identified across our global search for projects at this scale. What was surprising, though, is that this number almost tripled when we looked at the number of projects at the more than 1,000 user level. Now, what seemed to be the problem that held projects back in what we called the enterprise chasm? And the thing that we found was that the projects that made it across this valley into large-scale deployment focused on doing one thing and one thing very well. Now, that one thing could have varied dramatically from health worker training to providing messages to clients, but they were focused on a single feature that enabled them to leap across that chasm and achieve the levels of scale that we were seeing. Projects on the smaller end of the spectrum had multiple features, doing many things at the same time, potentially making it difficult to explain to different stakeholders, potentially making it difficult or complex to scale given the technical complexity of the system itself. So it's important to learn from these trajectories to scale as we move forward. Now you ask yourself, well, why not just put it out there on the App Store and see if it takes the trajectory of something like Angry Birds? But market-driven scale is very different than public health scaling of a technology, because market-driven scale has to both address utility, so it meets a clear need. It has to be desirable. And in public health programs, very often the person using the technology is not the same person paying for technology. So in one case, you have the health worker who's being told to use a specific technology, but the person paying for that technology is someone in the Ministry of Health far removed from the realities of the field, so that the payment decision is not in the hands of the people using it. It also has to be easy to use and affordable and provide a replacement for something that is currently in the status quo. And so, although we can try market-driven scale approaches to moving some of this innovation into large-scale use, it's often not a very pragmatic approach to getting things up to the level of widespread use that we'd like to see them being used. The other important thing that we've learned is the importance of human-centered design. Now, this is something in public health we don't often spend much time in training our students. But in fact, it's a critical function of developing programs and new innovations that really listen to the stakeholders that ultimately will use and will benefit from the technologies that we're creating. And I think, as this quote from Melinda Gates illustrates, the importance of really understanding the end user is absolutely irreplaceable. Sometimes we spent upwards of a year mapping and understanding the needs of our end users before we even begin prototyping a new technology or an innovation. It's also critical to understand where we are in the maturity of our innovation, because that will also drive the kinds of questions we ask about the success of the innovation itself. So across the spectrum, you may be at a prototype or pre-prototype stage, a demonstration stage, a scale-up stage, and at each stage of this maturity cycle, the questions that you're asking of yourself will differ dramatically. Are you still at the stage where you're figuring out whether in fact your system works? That is to say, does the things that you intend it to do as a technology? Is it usable by the end user? Do they understand and repeatedly use the functions they're supposed to when they're supposed to use them? Is the system contributing to improved efficacy? That is, when individuals apply this technology, do we see a change in a particular performance or health outcome? And so, as you're in the early stages of a technology, it's not the right time to ask whether, in fact, the technology is having an impact on performance or health outcomes, because you're still trying to figure out whether the technology itself is stable and functional. So I think that distinction of asking the right question at the right time is something that we've learned in the past 5 years to be something very important in educating the broader community of practice around digital health. To this end, we've helped develop some tools, such as the MAPS toolkit for assessment and planning for scale, working closely with the World Health Organization and the UN Foundation to come up with a quantitative approach available here online across 6 different axes, looking at the maturity of a particular digital health program across its groundwork or preparedness, partnerships, financial health, the technology sophistication, how well the personnel and training systems are in place, and then what systems are available for monitoring and evaluation. Each of these axes has a scorecard. The users go through and answer the questions and allocate points according to their performance across these various axes. And then you get a sum total axis score for that axis. The summary scorecard allows you to identify the areas where you have performed well and areas where you might need to focus more attention as you go through your journey to scale. Now, keep in mind, scaling is a battle on many fronts. There's a technical development to really strengthen the architecture of your system to be able to scale. There's the monitoring and evaluation that is necessary to create the body of evidence that will convince the various funders and stakeholders that this intervention or this technology is in fact worthwhile as an investment. There's also training of health workers. There's the engagement of other partners that has to be done at the same time as you scale the implementation of your technology. And of course, understanding the enabling environment around the project itself, policies, human resources, infrastructure, funding, that will really be necessary to maintain and grow this program to national scale is absolutely critical. This was cemented in that report that we wrote for the Gates Foundation, where key informants repeatedly brought up this issue that what happens after scale-up is a neglected area of research, not just in terms of developing the software, but everything else that goes into that ecosystem. Procurement, distribution, training, financial management, monitoring, all of the stuff that happens that needs to be paid attention to. It's like we like to say, these things are right there in the room, but no one acknowledges them yet, like this poor elephant. And I think that's where there's still a vast amount of research and exploration that students and faculty working in this space can really elucidate. So scale is not only about the digital innovation itself, as we've been speaking about for the past few minutes, but really the ecosystem in which it's supposed to grow. I think one way we can deconstruct this elephant is to think about these three areas: man, machine, and system. At the man level, we're looking at human factors, resistance to change, threats to status quo. The social obstacles which are not addressed by the technology have to be addressed in order for us to see lasting fundamental change. At the machine level, we've talked about interoperability, which means different systems can share common variables, whether it's knowledge of a certain denominator or patient records that can be updated when one level of a health worker sees a patient versus another. True scalability. So can these systems really function once we have not just 100 users, but 1 million users across an entire country? What provisions have been made for redundancy when the system breaks or when a tablet or a phone dies in the middle of a day? What provisions have we taken to replace that device and make sure that that worker can continue serving the clients he or she is supposed to serve without having to sit for a week waiting for a new device to come to them in the field? And then finally, thinking in terms of the long term. You remember the earlier graph I showed you about mHealth not operating in a vacuum? Well, this is where we really have to think about, are we training the future generations of health workers, of doctors, nurses, community advocates who understand how to read a bar graph, a pie chart, how to compare percentages to understand who is performing well and who is performing poorly, who needs an extra bit of training in order to get to that last bit of their population in order to serve them with the care they need. We've developed a number of principles for digital development. These are available online under the ICT for D principles, and you can Google them and read more about how they've been developed. But over 300 organizations have endorsed these 9 principles that talk about the best practices that we think are important for developing robust systems for communities in low-resource settings. I think we also have learned that we need to close the information loop. Very often we think of data as filled with helium. The health workers who collect the data on the ground see their data floating up the chain to upper-level supervisors, and we never see that data again. That information that they've worked so hard to collect never comes back to them to inform them about the communities that they're working with. How are they performing? I think innovations in how we provide feedback to health workers and how we incentivize their performance are sorely needed. We also have learned that we need to engage government from the very beginning of the innovation cycle. Government very often is the end partner who will be undertaking the scale-up efforts of the projects we're talking about. And so making sure that they are on board as a partner, both in recognizing the priority of this program that's being developed, but also in understanding the various strengths and weaknesses of the program as it moves forward is absolutely critical. I think we've been able to develop some tools, such as this one, a planning workbook for country-level assessment. And with the Innovation Working Group and the Partnership for Maternal, Newborn, and Child Health, we've developed this planning workbook that allows you to work through stepwise and understand the country-level readiness for ICT innovation. And in our own practice, we've really tried to emphasize the engagement of government health workers in this process. In fact, we're right now engaged in one of the largest randomized controlled trials of a digital intervention among family health workers in rural Bangladesh using digital tablets to improve how they deliver services to pregnant women and newborns in their communities. And so we see here in these pictures, government health workers taking ownership and leading the charge of that very important scientific evaluation of a program so that they understand the potential impact of the work that they're doing themselves. So change is not easy, and I'm asking you to think about in your respective domains as you undertake efforts to think about digital health or optimize health systems or even build programs of the future, that there are ways to help make this pushing the elephant challenge a little easier. And technology may or may not play a role in that process. But it's important to understand the degree to which you're disrupting the status quo will be proportionate to the difficulty in moving institutional inertia, in changing a complex existing ecosystem, and in scaling this up at a national level. So be prepared for that challenge, but don't give up. And like this little boy seems to be doing, he's taken on a Herculean task with the knowledge that eventually that elephant is going to move up that ramp, and we will see a substantive change in the way that we deliver public health interventions around the world. However, here's another elephant that many of you may be familiar with, where we have the 5 blindfolded men trying to understand this very complex system. And I think this is a nice analogy to what a health system looks like. And, some of us work on the tail, some of us work on the legs and the trunk. But I think until we appreciate the problem from these different perspectives and understand that a problem has multiple good solutions, coming at this in an interdisciplinary way is absolutely critical. I think the other part that we have to acknowledge is not every problem is a problem for everyone. And I think that understanding and that appreciation that we need to align each other to a common objective and then move forward with defining a solution is absolutely critical. So with that, I want to thank each of you for taking the time to learn a little bit more about digital health. And I'm always looking forward to hearing from you. If you have questions, please email me. You can reach me on Twitter at @AlaBreek without the E, or come and look at the work we're doing at jhumhealth.org. Happy trails.